Hello friends, again this is Tembekile. Today we're going to talk about therapeutic ultrasound. Therapeutic ultrasound. We have two types of ultrasound that is used in medicine. The one famous one, the diagnostic ultrasound. But today we're going to speak about the therapeutic ultrasound that is mainly used by physiotherapists. I have a picture here of shoulder muscles because mainly it is used to treat soft tissue injuries. It is used to treat muscles, tendons, ligaments, capsules. It's also used for transdermal application of certain medication, a process called phonophoresis, where they use ultrasound, therapeutic ultrasound, to push the medication through the skin. We'll have a separate discussion on that topic one of these days. I've tried to make this sketch just for us to follow. If you can have a look on it. I try to make this type of diagram for us to follow it. Actually, it's a therapeutic ultrasound. Forgive me for the background noises that I don't have a control for it. Right, therapeutic ultrasound, we define it as any type of ultrasonic procedure that uses ultrasound for therapeutic benefit. This physiotherapeutic ultrasound was introduced into clinical practice in the early 90s, in the early 50s. And the ultrasound is applied using a transducer or applicator that is in contact or direct contact with the patient's skin. I don't have the machine now since I'm at home, but I will have a video when I'm in the clinic that will show the practical one. I have the other type of ultrasound. This one, I just show you this one. This one is just for the pregnant women, just to check whether but I just show you this so that you'll have a picture of, it's more or less like the head, the transducer is like this. But I will have the practical part of this when I'm in the clinic. I'll post that video. As I said, the ultrasound is applied using a transducer, the part that I just showed you, or the applicator that is in direct contact with the patient's skin. And this therapeutic ultrasound in physiotherapy is actually an alternating compression and a rarefaction of sound waves with a frequency of 0.7 to 3.3 megahertz. It can penetrate into the skin for 2 to 5 centimeters. Or back to this diagram. Why do we use the therapeutic ultrasound? What condition or what situation compels us to use this therapeutic ultrasound? Firstly, let's look at the soft tissue shortening or tightness or pain. If the patient, when we do maybe palpation of soft tissue and we discover that there is some sort of shortening or tightness, maybe with pain, let's say for instance around the calf muscle, this ultrasound can be used for muscle relaxation and pain reduction. For these two reasons, it can be used for muscle relaxation and pain reduction. But you need to be sure the reason why you will use your ultrasound, because your settings is always your setting is always different depending on what is your aim of treatment. If your aim of treatment is to loosen the shortened tissue or is for pain relief, you will have to manipulate the machine in order to get the thermal effect. The thermal effect, in fact, in order to generate heat within the cells. Therefore, you will have to use the 100% duty cycle. In other words, you put the machine in continuous. What does that mean? It means that in every second the machine or the transducer is applied on the skin, there will be ultrasonic wave passing through into the skin, which means the machine will work continuously. And that will create a thermal effect. A thermal effect is the part that is effective for pain reduction and muscle relaxation. And another point you need to take into consideration is the type of soft tissue you are dealing with. Whether it's a superficial tissue, in terms of ultrasound application, we consider 1 to 2 centimeter as superficial and 2 to 5 centimeter as deep. So any structure that is within the depth of 1 to 2 centimeter, we consider that structure as a superficial. Therefore, if the structure is superficial, that is within the depth of 1 to 2 centimeter, therefore you will set the machine at 3 megahertz. Other machine, they will have 3.3 instead of 3. 3.3 and 3 megahertz is almost the same. Any of the two is fine. If your machine is showing 3.3 megahertz, it's still okay for a superficial application. Therefore, your frequency will be 3 megahertz. For instance, if maybe you are treating deltoid muscle, then the deltoid is superficial. But if you are treating, let's say you are treating the infraspinatus and teres major, those are a little bit deeper, because the structure you are treating, a superficial structure, must be within a depth of 1 to 2 centimeter. Remember, there is still a skin, and there is fat tissue, and then is muscle. And some other patient, you must consider if the patient is obese, which means the thickness of the skin, the thickness of the fatty tissue is a bit thicker. So you need to consider that when you apply your ultrasound. So as I said, for thermal effect, that's 100% duty cycle, or you put it continuous. 100% duty cycle, which means the machine is working continuously. If that is for a structure that is superficial 1 to 2 centimeter, then you set the machine at 3 megahertz or 3.3 megahertz. And the intensity, you set the intensity for a superficial structure, you set the intensity at 0.5 centimeter, 0.5 watts per centimeter squared. That is for superficial structure. And the time you set on the machine, you set 5 to 10 minutes. 5 to 10 minutes per 2 times ERA. We'll explain the ERA later. What do we mean by 2 times ERA? Let's follow the diagram that I just put here. Then later we'll explain the ERA. So the first thing that I explained, if you want to treat pain, shortening, you will have to set the machine in order to get thermal effect. To get thermal effect that will treat soft tissue shortening or tightness or pain by causing muscle relaxation and pain reduction, you set the machine at 100% duty cycle or continuous. And then if that structure is superficial, you set superficial, which means it's 1 to 2 centimeter. You set the machine at 3 megahertz, your frequency at 3 megahertz, and your intensity as 0.5 watts per centimeter squared. And your time will be 5. The maximum time you can put is 10 minutes. Right. What if the structure is deeper, which means it's more than 1 to 2 centimeter deeper? Let's follow that one for thermal effect. If the structure is 2 to 5 centimeter, which means is deep when we consider ultrasound, any structure above deeper than 5 centimeter, the ultrasound cannot be effective for that structure because that structure is a bit far away for the penetration of ultrasound. It cannot be effective if that structure is deeper than 5 centimeter. So you can just have a picture on this ruler. From this point to this point, 1 to 2, if the structure is within this space, 1 to 2 centimeter, that's superficial. Deep is from here up until 5. But if the structure is deeper than this 5 centimeter, the ultrasound cannot be effective above 5 centimeter because it cannot penetrate that deep. So if the structure is deep, then the settings will be changed. Instead of using 3 megahertz or 3.3 megahertz, then for deeper structures, you'll have to use 1 megahertz. The frequency need to be 1 megahertz. And your time, you will start at 1.5 centimeter. 1.5 watt per centimeter squared up to 2.0 watt per centimeter squared. That is your intensity. And your time will remain 5 to 10 minutes per 2 times ERA. We said we'll explain the ERA later. Okay, before we continue any further, let's have an understanding of this term. We have what we call tissue attenuation coefficient at 1 megahertz. What do we mean by tissue attenuation coefficient at 1 megahertz? Since the body is made of different structures, made of different cells, those different structures will react differently to therapeutic ultrasound. We try to list some few structures here. We have blood, we have fat, we have liver, we have muscle, we have bone, we have lung. Then we have written what we call the tissue attenuation coefficient. What do we mean by this? We mean these different structures, they have this tissue attenuation coefficient of these different numbers. Then I will try to explain these different numbers. How these different numbers will affect the ultrasonic wave when we apply ultrasound. If you can see here, blood is 0.18 and then fat is 0.6. The attenuation coefficient of fat is 0.6. The lower the attenuation coefficient, the slower it will take to heat up that part of the body. Let's say if we take fat is the lowest. It's a 0.6 attenuation coefficient, which means the fat will take long to heat up. But if you look at muscle, the muscle are still low. Muscle is 1.2 to 3.3. That attenuation coefficient for muscle, of which is still low, which means they, from blood, fat, liver, muscle, they will take time to heat up. It's not easy to burn this muscle during ultrasound. It's not easy to burn your muscle. It's not easy to burn your liver. It's not easy to burn your fat. It's not easy to burn your blood. Fat is more like an insulator. Right. But if you look at the bone is 20, is high. And then if you look at the lungs, it's also very, very high. Therefore, if you are treating, let's say you are trying to treat the tendon of the supraspinatus. If you are trying to treat the tendon of the supraspinatus, or you are trying to treat the supraspinatus, remember there is scapula underneath, there is acromion process, there is clavicle. So these bones around, they will react differently to the muscle you are treating. So a clinician needs to be very, very careful when he's treating a bony area, because this one can cause a burn quicker than the muscle. Therefore, the time you will have to spend on top of your bone, it needs to be very, very short. You need to adjust your time when it comes to treat a bony area like the acromion process or the supraspinatus. And again, I will advise not to apply the machine over the lungs, because it's double. You can cause a quick burn for the lung, because the attenuation coefficient for the lung is very, very high. It's 40. So any bony area or lung, you can apply ultrasound over the bony area, but you need to be very, very careful, because you can easily cause a burn. But for the lungs, I think it's completely contraindicated to apply ultrasound closer to the lungs. Okay. Let's continue a bit. So for deep tissue, 2 to 5 centimeter, you apply 1 megahertz, and with the intensity of 1.5 up to 2.0 watts per square centimeter. And you use the time of 5 to 10 minutes per 2 times ERA. The ultrasound can be used for 2 different effects. Thermal effect, as we explained for thermal effect. We can also use it for non-thermal effect, where you don't produce heat. Why will we use ultrasound for non-thermal effect? Mainly for delayed tissue healing, which means for prolonged inflammation. We don't need heat here because there is inflammation. Heat is contraindicated for inflammatory condition, because if you put heat, you exacerbate the inflammation. So for any inflammation, If you use ultrasound for a prolonged inflammation, you have to use a non-thermal effect. The aim of your treatment is to jumpstart healing process. That is the aim of your treatment. Whereas for thermal effect, the aim of your treatment for thermal effect was muscle relaxation and pain reduction. But in this non-thermal effect, our aim of treatment is to jumpstart healing process. How do we make our settings? Then we put the machine on 20% duty cycle. What does that mean? You don't put the machine in continuous, you put it on 20% duty cycle. Let's say for the time you have taken, let's say you take 5 minutes for your treatment. And then if you put the machine on 20% duty cycle, which means 4 minutes of that time, this machine will not be emitting ultrasound or ultrasonic waves through the skin. So this one is pulsed. There won't be heat generated. It's non-thermal effects. And then also you follow the same procedure. If it's superficial, that is 1 to 2 centimeter, you set the machine at 3 megahertz or 3.3 megahertz for your intensity. For your frequency. Then for your intensity, you put the machine at 0.5 to 10 watts per centimeter squared. For deep, you apply the same procedure. Deep, that is 2 to 5 centimeter, you put the machine at 1 megahertz, and then you can start at 0.5 and increase your treatment as you continue, as the patient continues to tolerate it, up to 10 watts, your intensity up to 10 watts per centimeter squared. The time is 5 to 10 minutes per 2 times ERA. Right. Let's have a look. Let's have a look. I've tried to draw this. This is the head. This is the transducer of the ultrasound. This is the head of the ultrasound. The part that we'll use to apply the ultrasound. The ultrasound will be a machine. We all know the ultrasound is a machine like this. The head will be something like this. So which means this round head that we use to apply ultrasound, the diameter of this, the area where we apply our ultrasound, we treat ultrasound, must be twice the diameter of this head. This is what we call 2 times effective radiating area. That is ERA, effective radiating area. Which means if I'm going to use this head, the area that I will treat will be twice the size of this head. Therefore, I will apply my gel to the area twice the size of this head. And then the way that I apply my ultrasound, I will make a circle, each circle per second. Thank you very much. I think my battery is getting low. We will end our video here. Thank you very much for your time and listening. We will do the practical part of this. As I said, the most important part is that the area you will treat must be twice the size of the head. The diameter of the area you treat must be twice the size of the head. And then each time you turn the head, you must turn the head not too fast, not too slow. Each circle per second. So something like this. Let's say 1, 2, 3, 4. Each circle per second as you move the head over the area that you are treating. Thank you.